Hi everyone, welcome to IQI Canada Evening Talks. My name is Yousaf Iqbal, country for Juwai, IQI Canada, and we are back with one of our popular sessions, which we have it every month, which is basically insurance with Anthony Mendes. Hey Anthony, how are you doing?
Hi, Yusuf. I'm good. How are you doing?
I'm doing very, very well. You know what an amazing topic we are choosing today because travel insurance, and I just came back from my traveling, and now the topic which we're choosing to ask you question is about travel insurance. Let me ask you first of all, how have you been? How you been doing? All okay with you?
I've been doing good, Yusuf, and I saw some of your pictures on Facebook regarding your travel to Malaysia. Was it right?
Yes, that was in Malaysia.
And
Right
I
now.
saw your success over there, and you jumping all over the place. And
Thank
those were,
you.
I think, so 1,000 agents that were with you. Wow.
Well, actually, about for 4,000 agents, I was one of the speakers there as well at the convention. There was
Oh,
about 4,000 agents on day one, and then next day we had about close to about another 3,000, 3,500 agents. Then we had the festival on there. So it was like a 2 day event, but it was a really, really amazing event.
so if I'm not wrong, I think so. IQA is big world over, correct?
Yeah, yeah,
Especially
very
in
big. But
Asia.
then we are very big in Asia. But then this is like this. We had this event at KLCC, which is the center, like a downtown center, and they could accommodate only 4,000 people. They could not take more than that. So our agents just in Malaysia by itself is account to close 20,000 agents. But then they could not. We could not fit all the agents in. So it was like most of the agents who's already have booked it earlier were able to be there.
Oh, wow. 20,000. IQI has 20,000 agents?
30,000 worldwide and 20,000 just in Malaysia.
30. So you have a force of 30,000 worldwide.
That's right. That is a,
Okay,
we are
wonderful.
in 20 countries. All the country was
So
there. So a lot
if
of fun.
if 30,000 agents were to travel to Canada for a seminar or for some, so they would need travel insurance, right?
Absolutely. Yeah,
Wonderful.
that's what I
Yeah.
said. Fits right away on that. So that's let's just jump straight to the topic. So my question is that why is a travel insurance required? First of all.
Yeah. Use of travel insurance is required for various reasons. A lot of coverages you want. Now you have traveled so much. What is the biggest problem you have now whilst
It
traveling?
could it could be a lot of things. It could be you could get sick. You could miss your flights. There could be so many things
Yes.
could happen to you
So,
on that. Yeah.
the first thing that comes to mind when you travel and talk about travel in Canada is Air Canada has become very popular for that,
Yeah.
unfortunately.
Yeah.
Lost baggage, right?
That's right.
Missed connecting flights,
That's right.
uh, and then overstay. I mean, because you miss your flight, you're going to stay somewhere, right? Who's
Yeah.
going to take this? Who's going to pay for that? Sometimes
That's right.
airlines don't pay for that, right?
Yeah.
Sometimes airlines don't pay for your baggage if it gets lost. They might give it to you in 4 days or 5 days. You don't know, right? So
Mm.
travel insurance. The biggest thing that you said in the beginning was you get sick, right?
Yeah.
So
Yeah.
what are the biggest problem people face when they travel to? You can get COVID is one thing which is now in the past, but
Yeah.
waterborne sicknesses through
Mm.
water. I mean, you may be the healthiest person, but you can get sick because you were brushing your teeth with unclean water. You're not
True.
consuming it.
True.
You're not
Yeah.
consuming it, but you're just brushing your teeth from the tap water. Like you go to Cuba, you have to be careful of all this stuff. You go to Mexico. So traveling, if you get sick, you land up in the hospital. Who's going to take care of you? Even if you
That's
land
right.
up in the hospital for 1 day, 2 days, who's going to
Yeah.
take care of you, right?
Yeah. Yeah.
Travel insurance, fortunately, covers you for you. You get robbed at gunpoint in any country. Right?
Yeah.
If you have travel insurance, you call the helpline. They will help you. They'll tell you what to do. And the
That's right.
helpline is open 24/7.
Hmm.
So if when you buy travel insurance, you're going with a company with a peace of mind that there is a companion who's overlooking your issues. God forbid something were to happen. But
Yeah.
24/7 they're open. You can call them anytime. Say this has happened. I was mugged. I was robbed. I'm hurt. Our taxi met with an
Hmm.
accident.
Yeah,
Please help me. They're there to help you.
very interesting.
Yeah.
Travel insurance covers quite a bit of things. So, I think another question comes to me. There's, Canadians travel a lot to USA, and then Canadians who are not traveling, which is excluding USA. Now, people who are traveling to USA, it's become like, you take a day trip or you go to Buffalo, you go for a couple of days and things like that. How does that comes into play while traveling to USA or without USA?
So, good question, Yusuf. So, Canadians traveling to the USA or
Yeah,
Canadians traveling to other
outside USA.
countries,
Yeah.
right, outside Canada. So, if you're a Canadian, you must have the OHIP card
Yes.
in Ontario,
Yeah,
or whichever province you are, you have to have the health card of that province.
that's right.
Only then the Canadian insurance companies cover you for travel insurance,
That's correct.
right?
Yeah.
So that is the number one criteria.
Mhm.
OHIP or other provincial cards, health cards, do not cover all kinds of expenses outside the province.
Okay.
Suppose you are an Ontario resident, you are just traveling to, let's say, Montreal.
Yeah.
It's a 6 hour journey, and God forbid, the car meets with an accident. Now you have to be airlifted to
Yeah. Yeah.
a hospital. Who will cover for that? OHIP will not cover your ambulance, air ambulance. Your
Hmm.
travel insurance will cover you for that, for the air ambulance.
Okay. Interesting.
Okay. Another,
Okay.
another thing, if you meet with an accident in the province of Quebec, again, road ambulance will not cover you. It's your travel insurance which will pay that price.
Oh wow. Okay.
So
Very
just
interesting. Yeah.
one small thing I'm telling you,
Yeah.
traveling. So now, if you're a Canadian and you're traveling to say USA, so if OHIP does not cover you in Canada,
Hmm.
inter-province, how will it cover you outside Canada? Even to the USA,
Hmm.
you've gone for a day trip, you've gone to Military Mall, to Buffalo.
Yeah.
A lot of people travel to buy groceries now, right?
Yeah.
To Buffalo. They
Yeah.
don't have any travel insurance. What if
That's
your
right.
car gets hit there? What
Hmm.
if you get robbed over there? Main thing is robbed, okay, but the main thing is, if
God forbid something happens.
you
Yeah.
get sick,
Yeah.
something happens. What do you do?
Yeah. Hmm.
So, in medical expenses in America are very expensive. So that's
Okay.
why all insurance companies make sure where are you traveling? Are you traveling
Hmm.
to USA or you're not traveling to USA? So you have to tell your broker where are you traveling. Even if you're traveling from here to America, and you're taking a connecting flight, you must tell your broker I'm traveling to USA and I'm taking a connecting flight to Bahamas.
Oh, nice. Okay.
So
Yeah.
then that has to be covered under your plan. He'll give you a policy that covers you America and Bahamas.
So basically, every time you're traveling, whether it is like even if it's a road trip going to US or by connecting to any of them. What if you're connecting to multiple countries? For example, you are going to Mexico and then you are connecting to USA, or at the same time you're going to Malaysia, for example, and then I was flying to Turkey. And you're going to Istanbul, although your stay might be there for a couple of days. So do you like want to be like telling your
So
broker the whole thing?
so the US, so the Canadian companies, insurance companies, they ask you only one question: Are you traveling USA,
Okay.
excluding USA, or you're traveling worldwide? When you give them worldwide, then all countries come into.
Okay. Good to
You
know.
can travel to any country.
Hmm. Okay. Great. Great.
So then you buy a policy which is worldwide,
Okay.
including
Then
USA.
then doesn't matter whatever stopovers you're getting,
That's right.
wherever you're
That's
getting
right.
basically
Yes.
covered on that.
Whether you are whether you're traveling to Karachi and you on the way you stopped at say Malaysia and you got sick over
Yeah.
there, it'll
Yeah.
cover you. Or you got
Very
sick
covered in
in
that.
Karachi and you travel through Malaysia, you'll be covered there too.
Hmm.
So those
Okay.
are the things.
So Another question coming in my mind, Anthony, is that what if somebody is covered from their workplace? Are they covered through their workplace? Number one, while they are traveling, or is it, or are they really covered, or they're not covered? And
So
if they're
Yusuf,
covered, like yeah,
they need to ask their travel, their health and dental plans that they have through the group plans they have through the company. They need to know if they're covered and for how many days they are covered. So suppose
okay,
if they're covered for say 30 days, example, I'm giving 30 days, they're covered through their company through travel insurance for 30 days, and they're staying for another, they're staying another overstaying for 15 days. That makes it 45 days. They can always buy a top up from a different company.
mm, mm,
It's only
okay,
called a top up policy, which they can buy.
okay,
So
top
that
up,
won't be expensive. A top up,
okay,
yeah. And they need to ask their group plan or group administrator if they are covered or they're not covered for the
okay.
travel plans. Yeah.
That's good. And then how much insurance should I buy? That's always the question, right? I mean, what kind of policy should I be looking at? What should be the amount I should be covering myself for?
See, so you asked a question which is very subjective,
Hmm.
but so how much should I be covered for emergency
Yeah,
travel? How much should I
yeah,
be covered for my trip cancellation? It's
yeah.
these are different questions. Your trip cancellation, your trip interruption. So, uh, and of course, death and dismemberment. It's called death and dismemberment. Am I covered for
Hmm.
that? Yes. So under the medical insurance, emergency medical, you're only covered for emergency medical, nothing else.
Okay,
So emergency medical is the bigger portion. You can be covered up from 5 million to 10 million. So
okay,
most of the companies cover you for $5 million of coverage
okay,
outside Canada.
okay,
But you must have valid OHIP card. You must have valid the provincial health card with you.
okay.
Mhm.
So you'll be
So it
covering
is
that.
five.
Yeah,
It is $5 to $10 million.
five
It
ten million
depends
dollars.
from it. Yeah, 5 to 10 million. It depends from company to company.
So also like when you are booking up your tickets, right? Especially if you're going to any of those other websites, there's something called like a trip cancellations. There's all
Yeah.
options like travel, like trip cancellations coverage and all that. Is that also part of the travel insurance, or if you buy that from that trip cancellation, is that covering you just for the trip, or is it covering you for whatever we talk in terms of the health and stuff like that?
Oh,
Can
so
you hear me? Yeah.
yes, I could hear you. Just I'm having these, in my office, I'm having these renovations,
No, no
so
worries,
they
no worries.
sound
Yeah.
good. So, sorry for that, Yusuf. Bear with me. Now, the question was that
The trip cancellation, right?
trip
So
cancellation.
normally,
Yes, yes,
yeah. So you'll see there's a trip cancellation option which
yes.
is given to you when you're booking up a ticket. Now, that trip cancellation, is it just for your ticket coverage, or is
So,
it also covering
no, no,
other
no.
stuff?
So it's for the trip. It doesn't say anywhere ticket, right? So
Yeah.
suppose you buy it. Suppose you're going to spend $3,000 on your trip, right?
Hmm.
And that includes the ticket as well.
Yeah.
So you can buy the whole $3,000 of trip cancellation, or it's up to
Okay.
you to buy only $1,000 of trip cancellation because $1,000 was your
Ah.
hotel expenses.
Okay.
The if there's a flight cancellation, definitely the flight would be covered by the airline company,
Okay.
right?
Okay.
But airline will not, for God forbid, if somebody falls sick in the family
Yeah.
and
Yeah.
you cannot travel now, and you had planned this in advance, and it cost
Mm.
you total $3,000, and
Mm.
you cannot travel because your aunt died or somebody expired, passed away in the family, then
Yeah.
what? Then all that is
Mm.
covered through trip cancellation
Oh, I see. Okay.
because
Okay.
airline will not reimburse you and say, sorry, ma'am, you know, our flight is going, you canceled, we will not cover you. But you can now go now. So that trip cancellation will cover that. Uh,
Okay.
you got sick for whatever reason, you can't travel now. What happens? That trip is cancelled. So that will
Yeah.
all be covered under this plan, under the trip, whatever you take, 3,000, 5,000, but you have to buy that amount. And that makes the
Yes.
policy expensive also. Yes, it
Yes.
does make an effect on the premiums.
On your policy, premium as well on that. Great.
But
Thank you so much. Yeah, go ahead.
I said it won't be three. Suppose you buy a 3,000, you're paying for the trip $3,000. The premium will not be $3,000. The premium would be probably $500 or $600, right? So
But
again,
the coverage is more.
you're you're leveraging the $3,000 against the $600 plus the 5 million travel plan that you bought
Makes
within
sense.
that $600, right? So you've
Makes sense.
leveraged 5 million and 3,000,
Makes sense. Makes
right?
sense. That's
Yeah,
a very good point what you made right now because a lot of people think they're just covering it for that particular trip, and people say, okay, I'm not going to be spending another $500, $600 on it, but actually it's just not that $3,000 is there plus the 5 million as well, just in case
that's
something
right.
happens on that. So which is
That's right.
again, a lot of people are not aware of it on that. Uh,
So,
Auntie, thank you so much. Amazing episode, and I know I have more questions as well, which I want to continue on my second episode as well. Anything you want to say to our audience before we say bye to them?
I would just say one piece of statement that I would make: whenever you travel, travel safely, and of course, look to cover all your liabilities. Thank you.
Thank you very much. We were live with Anthony Mendes, who is a broker with Able Insurance. Please feel free to contact Anthony if you have any questions. It's really nice of him that he shares this information, which is like a general public knowledge. A lot of times, I have come across so many things which I wasn't aware of it. If you have any questions or any comments, do let us know, and we'll see you again soon. Take care. Bye bye. Bye.
Thank you,
Bye, Anthony.
Yusuf. Thank you.